All right, I think we are live. It's home. I think that's everything live. I'll just refresh over here. Awesome. Okay, guys, I'm going to start off today's live session talking about sitting. Why sitting makes your sciatica, coming from here in the lower back, a lot worse. And I will add on a little bit later talking about why sitting can sometimes make it feel better. And to do this, I think the most important thing to understand is really looking at the spine, because that'll help the second part a little bit more. But when we are sitting down, we are putting around about 40 to 90% more load through the lumbar spine. So most of you guys from the comments, right, and get a lot of comments, around about 90 to 95% of you guys have issues down here in the lumbar spine. L4-5 and L5-S1. That's the last green and green-orange section of the lumbar spine. It's where basically everybody that has back pain and sciatica has the majority of the issues in their lumbar spine. That's not to say we can't get other areas, but those are the epicenter for the vast majority of you. And that's where your sciatica is going to come from. Sciatica doesn't come from up the top here. For example, it comes from these sections because these little nerves that come out the bottom here go on to form or join with some of the other, from the sacral plexus, the sciatic nerve. And so we have an injury to a segment of the lumbar spine. So L4-5 or L5-S1. The injury is a load-bearing injury. It's compression that has resulted in the injury here. Very few of you will be in the scenario where maybe you were parachuting or something like that, or something like that, and you got a stretch injury. Most of it is compression. You were leaning over to grab something. You moved in a certain way, and it was the compressive load of gravity, maybe with a bit of twisting and bending, etc., that created that strain. What's the worst thing you can think of? Carrying extra stuff. Why? Because it's a load-bearing injury. And so when we are sitting down, even if we're sat as well as we possibly can, we're putting 40 to 90% more pressure through this section of the lumbar spine, which explains why it is so painful for many of you, why there is load intolerance. And all too often people make the mistake of going, well, I want my sitting to last longer before I get pain. And you have to understand that the pain-free sitting, or increased duration of pain-free, aggravation-free sitting, comes from you guys actually building resilience back into the lumbar spine. It is your rehabilitation work, rebuilding strength and resilience into this lower back. That is the thing that gets the consequence of increased durations of sitting being not painful, increased durations of walking being not painful. The list goes on. It is through your rehab that you are rebuilding something that results in real world benefits that make you feel better, right? I've got a comment here. I'll just go off on a tangent here quickly before I get on to the other example, which is when sitting makes you feel better, because that is a big trap that you really want to avoid falling into. So AJ Tweets has said, the Roman chair holds legitimately take my pain away. And that's awesome. Like you're finding that really helpful. It's activating the muscles. That's fantastic. But with regards to the Roman chair, the real question is, what about if you just use a hip hinge, right? Because all the Roman chair holds are doing are holding you in a hip hinge position. You're just really, really thinking about it because it's overt rehab. And I mentioned many times before, I think the Roman chair fundamentally is an extra stumbling block that you just don't need, right? You can just do a hip hinge. You can just be there and just do a hip hinge, right? That is exactly the same as what you're doing in the Roman chair. There is functionally absolutely no difference. But for some people, like the confidence or the routine of getting in and out of that chair might well be what helps you just dial your focus in. But practicing it in the real world, I think, is always, always, always a better thing. And I think the Roman chair specifically just creates unnecessary disconnection between the movement and the movement in the real world, which is the hip hinge, right? The Roman chair is just doing a hip hinge. And it just creates that extra disconnection. Whereas if we do an actual hip hinge or an RDL, for example, we're learning a movement that directly translates because we're doing that movement in the real world every single day anyway. So it's just something worth bearing in mind with the Roman chair. I know it helps so many of you guys, and if it helps you, like, all I really care about is that you guys get better. Like, I don't care. If you like the Roman chair, you want to use it, fine. But that's just my opinion on it, because many people have heard about things like the Roman chair and want to evaluate if it's appropriate, if it's appropriate to them or what the best route might be. And so that's all that matters is you guys get better at the end of the day. That is all that matters. And so, yeah, hopefully that makes a bit of sense. Now, as it comes back to the sciatica specifically, this peculiar situation where we have a verifiable injury to the lower back that is giving rise to sciatica, symptoms going down the leg, irritating maybe L4-5 or L5-S1, sending signals down the leg of that sciatic pain. And we find that sitting down actually relieves. Yeah, but Mike, sitting down relieves the pain. Why is that? the reason is very simple. For a lot of people, the disc bulge, and this really confuses a lot of people, because they get an MRI and they get the disc bulge and it says, well, the disc isn't pressing on the nerve, so we don't know why you have sciatica. It's like, well, come on, let's think a little bit actually. We've got an injury to the disc. There's going to be inflammation around that injury, right? Down here in the lower lumbar spine. And so just because the disc isn't pressing on the nerve doesn't mean the nerve can't be irritated by the inflammation, a perfectly reasonable reaction to an injury down there in the lumbar spine. And so what happens is there's inflammation congesting this space, irritating this nerve. And when you sit down, we make the space larger. And that's why it's relieving. And that's also why many of you that find sitting relieving often find when you go to get up, it is painful again. And you might even get that sharp pain, or you might even sharp shooting pain, and you might even find that you get stuck halfway up, like you go to get out of the chair, you're like, oh, I feel better now, and then you go and you're, oh, I can't move, I'm stuck, right? And the reason for that is inflammation has filled this space, excess fluid has filled this space down here, and as you go to stand up and make the hole smaller again, because there is extra fluid in here, and fluid is non-compressible, you just get stuck, the whole, and it's, the pressure's max in there, and boom, you've got the pain. And it takes a moment of moving around before you can actually straighten yourself up. Now, thankfully, a good number of people that feel this phenomenon actually find that when they stand up, they can get a little bit of movement, it frees the spaces in these little holes where the nerves come out, and they can start to move properly again, or closer to properly. It might still be painful, of course, but that's what's happening. And unfortunately, because it feels nice while you're sitting, you tend to do more of sitting. And because you're doing more of sitting, you're putting more pressure through squashing down on the front part of this disc. As opposed to squashing down perpendicular, you're squashing down like a wedge, more pressure through the front, and stretch on the back, and that's creating more strain through the posterior, the back part of these discs, where those discs are bulging. And that then puts more strain on the tissues that are trying to heal, and we get stuck in this vicious cycle. And that's a very important cycle to break. It requires good understanding. Like, you really need to be thoroughly happy with that kind of explanation so that you can avoid the sitting and start to do smarter things, and you will find that you get better, but you've got to break that cycle. Because all too often people get caught up, especially if sitting is relieving, with this constant cycle of aggravating and re-aggravating the situation in the lower back. So guys, I'm just gonna go through some comments on TikTok. Those of you on YouTube, on X, if you've got any questions, any comments, you can post them in the comment section. I've got that up here as well. So hopefully this will be helpful for you guys. Tattoos by Gira. I said, I'm a tattoo artist and most of my time is spent sitting down. Is there anything you recommend? Some of you guys have occupations, jobs, etc. that are daily tasks that are more difficult to navigate, and that certainly is going to be one of them. Hairdressers, truck drivers, the list goes on. It's a bit more challenging. Parents of young children. The most important thing you can do is have some kind of appreciation for the neutral spine. Do the best you can. It might be that you adjust the chair so you can use something that looks a little bit more like, let me just show you guys, like a chair like this where you've got a bit of a saddle so you can kind of perch a little bit more while you're doing your work. But ultimately, if you're a tattoo artist, you're doing very detailed, focused work for an extended period of time, I imagine, right? And so it's difficult to get around that. But what you can do, because the body is really quite remarkable, it will be able to get better in spite of these things, is you just got to win the day where you can, right? So you do the best you can while you're doing your work. You got to do that to make a living. We can't stop those things, right? But the other hours outside of work, you've got to win, right? You've got to do some remnants of relief-based work, right? Those of you guys that have joined the program, this is like the core relief work, right? You've got to do the rehab work to build strength and resilience. If you do that, you will rebuild the strength and resilience of your lumbar spine so that you can tolerate those kind of things more effectively. And if you can manage and tweak and change elements of your workflow, that's going to be particularly helpful as well. And so you've got to do the best you can, but you need to have a solid structure to follow in the time that you're not working. And I think people need to make sure they're doing everything they possibly can in the time that they are trying to get better and doing stuff that objectively is working towards building back health and rebuilding this area, and do the best you can in certain circumstances that you just can't change, right? I don't think it's practical to quit your job so you can get better with your back. Really work on actually doing, you know, are you 100% effective when you're outside of work, when you're doing your free time, with doing stuff in a back-friendly way, making time for your rehabilitation, etc. Because if you're not, make that change first, because you will be surprised what the right stuff can do, what a little bit of education can do, and what a little bit of care of self can do, in spite of the bad things that you have to do every single day that aren't optimal for recovering from back pain. So I'd start there and definitely check out the link. Those of you guys that need more help, check out the link in the profile page, because there's more information on the Back in Shape program, which gives you that structure. That's what's going to help you guys get better. We've got a comment here. So if you have a herniated disc in L5S1, should I do weighted squats and RDLs, etc.? You should do squats and RDLs. Two of the fundamental exercises, probably the most powerful exercises for your back rehabilitation are going to be the squat and the hip hinge. The hip hinge, for those of you that like going to the gym, would be an RDL fundamentally. Why are these so impactful and important? Number one, they are the safest movement that you can use to scale the loading. You could put in third place maybe something like a farmer's carry, but a farmer's carry is walking. You need distance. You've also got the fact that you're weight bearing on one leg versus the other. Whereas with a squat and hip hinge with good form, you literally hold the weight, you go down and back up, and with practice over time, you get very, very effective. So technical errors tend not to be a case, not to be a worry over the long term. Number two, they are applicable to daily life. You are doing squats and hip hinges whether you like it or not. You are doing squats and RDLs whether you like it or not every single day, no matter how bad your back is. And so you can either do it in a way that makes this thing worse and perpetuates a problem, or you can start to learn to do it correctly. However, you are completely missing the point, and this is not to say this is the person who's posted this comment, but one would be completely missing the point if you just think, great, I'm going to go to the gym tomorrow afternoon and start doing squats and RDLs, because you will mess yourself up. You need instruction. It's not a foregone conclusion that you can do these things effectively. No more than I can go and fix the plumbing. I don't know why with exercise, because we've got a body, we assume we can do everything correctly. Like, it's really quite bad. I wouldn't assume I can fix the sink. I wouldn't assume I can fix the electrics. I wouldn't assume I can fix the car. There are many, many areas that I do not have expertise, and you lean on others to help you with that process. But too many people go, I will just go to the gym and do some exercise. Yeah, I'll just go and tinker around with the fuse board and see how that ends up, right? I know it's a bit of a facetious example, but hopefully it makes sense to you guys. And so how we go about this is important. Get your technical foundation first. You need to actually be able to do that correctly in a way that protects the neutral spine. If you're doing squats, for example, some of you guys will get away, depending on how chronic you are and other factors, you will get away with rounding your lower back when you squat. That won't hurt for some of you. That's why we have two categories that all of your exercises should fall within: correct choreography and aggravation free. Because some will get away with incorrect choreography until you start to load up, then all of a sudden a problem arises. And so we should learn to perform those exercises technically correctly. The benefit of that for your lower back recovery is that you start to immediately have spillover benefits. When you're getting out of chairs, when you're moving around, when you're brushing your teeth in the morning, in the evening, whatever, while you're washing your face, you are doing those movements, and so you benefit from doing them better. In the medium term, you're going to strengthen up all of the tissues, which obviously is an advantage. That's the tissues excluding the spine itself. But in the long term, steadily applying load consistently over the long term, you're actually going to rebuild the strength and health of your spine. You go from doing 5 kilos and struggling on a squat or hip hinge, sorry, it's over there for those of you on YouTube, and then you go up to doing 50, like tell me you haven't strengthened this area up. You haven't like created a bypass for the weight to go around the disc. It's gone through the disc. The disc can bear more load. You've made objective strength and improvement in the process. Now, Adam has said, I am a lifter. It can't be the case that my mechanism of disc injury was due to poor mobility, repeated butt wink, and deep squat, and core strength wasn't really a factor. It certainly can be, but that means that you haven't been, I would argue, using your midsection to control your spine effectively. So it's strong, but it's just being deployed in a bad way. And so you would probably benefit relatively quickly from learning the correct form and rebuilding relatively quickly. But equally, because you've got that habit, I suspect, of repeatedly doing the butt winks, etc., you've led to that injury, and you're going to find it difficult to correct that technical error. And so going back to basics and then rebuilding again is going to be important. The good news is, if you are a lifter, if you are someone that's messed it up in the gym or outside of the gym, but you've still got a reasonable amount of strength, you guys have a smooth recovery. You learn that relatively quickly, and then you deploy that modification of technique. You stop doing the butt winking, and then you build your load tolerance back up. For those of you in that particular category, specifically, those of you that actually can build the weight back up relatively quickly, you just start deploying your strength in the right sort of way with balance to protect this area of the lumbar spine. You might well find you get to so we create a number of criteria, right? So if we start from an evaluation point, Adam might fly through these. Some of you guys will struggle to get through these in a timely manner because everybody starts from a different place, right? But the journey through the process is the same. It's just that we go through slightly different challenges along the way. You take 40% of that body weight target, right? So we say when you're sitting down, you're putting 40 to 90% more load through the lumbar spine. So the first target would be, can I squat with that 40% figure? So for me, weighing 90 kilos, 93 kilos, around about 50 kilos of upper body weight is on my spine. So can I squat hip hinge effectively with good form without doing a butt wink? Can I squat with 20 kilos? Yes. Can I squat with 45 kilos? That's a 90%. Yes. Can I now squat with my body weight, 90 kilos? Squat or hip hinge, whichever one you prefer. Yes. Once I've hit those targets, I then, Adam will probably have to do this, go and say, right, do I have appropriate levels of hip mobility? You can measure that pretty easily. Like when you do a hip hinge, can you get back to horizontal? Like me, I've got room for improvement with my hip hinges in terms of my flexibility. The strength is there, but the flexibility needs improvement. Adam might be in the same category. And so that means he needs to then go off on a bit of a tangent and start working flexibility. But he's built the strength first. And he's relearned how to do the technique in a way that's actually advantageous for the lower back rather than detrimental. So that's the kind of the way that you want to go. The secret team has said lower the weight and choreograph the movement. Yeah, exactly. That's what we need to do, right? A lot of the guys in the gym, like, you've got away with things for a long period of time, like the butt wink. Like, I'm not going to sit here and tell you guys, I've never had my lower spine like round a little bit when I've done a squat, a heavy squat. Like, I've done that, right? You guys, those of you that lift and work out in the gym, it's happened to all of us. We've been there on a squat and we've been like, it's the last rep. I'm doing sets of 3, 4, 5. I'm going to just bury this one to try and make it. Like, I'm not stupid enough to think that you guys haven't done that, because we've all done that, myself included. And I definitely don't sit here on a throne saying I haven't done that. I have done that. But the problem is, when you've got a herniated disc, then you can't afford to do that. Because when you do that butt wink with the herniated disc, L5S1 is a compromised section. And whereas before that butt wink kind of spread out across a number of segments, because these are all nice and strong, once we've got the herniated disc, we've got a weak point. And that weak point wobbles in the wind. And so when you do that butt wink, because the muscles no longer provide stability, all of it goes through L5S1 and now it focuses through that section. I use the example, hopefully this will really make it real for a lot of you guys. If you are driving in the car, you suddenly brake, everything, the chassis of the car, the suspension, the seat attached into the car, the seat attached to you, the belt, it all absorbs shock. If you brake at the same speed, under the same circumstances, but your seatbelt is held loose, that same strain focuses to your collarbone, and all of a sudden you go boom, and all of that force focuses to the collarbone, you've got a fractured collarbone, maybe a first rib as well, right? It's the same instance, but because there's that laxity now, when you do get that failure of technique, those of you guys that have background in lifting and you're trying to rehab to get back into working out, you pay for it, and you pay for it dearly. And so that's something to really be mindful of. Hope it makes a bit of sense. Hopefully that tangent was worthwhile for you guys, any other comments you guys can post wherever. So over to TikTok. What have we got over here? I have a retrolisthesis of L5S1. It is very common, guys, to have, I won't say it's very common, but it is certainly far from unheard of to have a retrolisthesis at L5S1. They tend to be self-limiting. And what a retrolisthesis is when the vertebra slides backwards. It's a form of spondylolisthesis, right? Normally we think about the spondylos, they slide forwards, okay? And we get grade 1, 2, 3, 4, depending on how far it goes. Retro is where it slides back. But if we have a disc injury, a herniated disc, what has happened is the disc has gone from that higher part and then it's gone down to here. And often it creates a bit of shearing. It's that instability that we were just discussing. And so it's not beyond the pale for it to shear backwards a little bit. People often notice with this sort of phenomenon that when they do things like the cobra, it hurts because it's shearing, it's not bending, because there is an injury to that segment and we need to provide stability there. Just wiggling and bending and twisting and doing all your knee hugs and child's pose and knee rocks do not resolve this issue. They only serve to make it worse. And it's why stability works so well across such a broad spectrum of specific and nuanced diagnoses. If you do the stability work, it provides that protection. Sat says, I have got a pain in the left buttocks and sitting makes it worse. That very much sounds like it could be related to your lower back. That would not be at all abnormal. More comments. When TikTok flicks all the way down, it does make it difficult to catch up. I was up last November for an updated MRI because my 2 right toes went numb. Can't see the rest of that, sorry. L4, L5, S1 disc bulge. Yeah, so I think that's with reference to the sitting and getting the buttock pain. Too often, so there's one thing that's very important for all of you with back injuries to be aware of, and that is the red flag symptoms. Thankfully, very few of you will ever get those. More or less none of you will. It's very, very rare to get the full-blown cauda-equina. But you need to be mindful of the red flag because that's when you go straight to the hospital, right? You've got your saddle anesthesia. You've got your numbness in the area of your body being in contact with the saddle, right? loss of bladder and bowel control, a trauma associated with your injury, right? If you've just fallen out of a window, go to hospital. Don't go online to try and look up why your back hurts and you've got terrible pain. Go to the hospital and explain the circumstance. Right? Those are emergency cases. The vast majority of people do not have that. But most of you guys all have the same sort of section of the spine. You hopefully can see from these comments, the same sort of section of spine injured. But John has a herniated disc at alpha S1. He's got a bit of buttock pain. Sarah's got some sciatic pain down the leg. John, he's not really that, the other John, he's not really that sore. His back hurts a bit, right? The symptoms, you guys don't need to get too caught up in the symptoms. Sure, observe the symptoms, acknowledge the symptoms. They are there. They are the motivation, right? Often. But then do the work because you've got the injury. It's the injury that needs to recover. The symptoms, the reason that so many channels give out, I would argue, substandard advice is because they're always trying to give you little hacks to fix your symptoms in 3.5 minutes whilst watching TV. That's not rebuilding health. That's not building back. That's just a gimmick. And so you have to focus on actually rebuilding health and stability. You know the injury. It's lower lumbar spine. 90% of you guys have that. L4, 5, S1. The last two sections of the lumbar spine down here. Go about doing the rehab work. Thank you, Owen. That's a nice comment. I'm glad it does. L5, S1 disc herniation. Struggling to walk longer than 10 minutes. Do I just continue with rehab? Yes. You do the spine stability work. If you guys need help with structure, we have just released this Sunday the new upgraded version of the program. It is incredibly robust. There's 250 plus videos there, new live workouts. There's all the support, all the members stuff as well. That's all remaining. It's there to help you guys. That would be the best kind of rehab that you can leverage, right? Go and check out the link in the profile page. I'll put a link in the comment for those of you guys that are on YouTube as well, so you guys can go and check it out. There's a brand new video there as well. Watch the video, and if you like it, then you can join. But you'll notice that as you progress through the rehabilitation process, as your squats go from 5 kilos to 10 to 15 to 20 to 30 to 50, whatever it may be, you will then notice that walking goes from 10 minutes to 20 minutes. What often happens, quite frankly, is you're out walking the dog with your other half and they go, hey, user 4758266, you haven't been complaining about your back so much. You must be doing better. And then you go, huh, I guess that rehab's working. That's often what happens. Others notice it before you in many cases. Mary has said, update is the disc is more squashed, but no impending nerve root. No impeding on the nerve going down the right leg. Awesome, awesome. That's great. It might be more squashed, but we carry on with the rehab. Francesca said, is surgery my only option for 2 slip discs with nerves compressed and physio is not helping? What we are doing in the physio, Francesco, makes the world of difference. So many of you guys, your physio is, here's a sheet of paper. We've got some bird dogs on there. We've got a pigeon pose. There's knee hugs, child's pose, a bit of flossing, some Supermans and a piriformis stretch. That is a shopping list. That is not rehab. Most of your physio is just a shopping list. You see them once every fortnight, every month, or maybe once, and that's it. That is not rehabilitation. It's just not. When you guys go and join the program, which is the link in the profile page, you'll see what actual rehab looks like. It's not just an exercise. We talk about the squats, the hip hinges, etc. They are not, you don't just do them once. How you do them changes over time. And that is a program, not just physio. Physio, unfortunately, is such a nebulous term. It doesn't really mean anything. Because some of you guys will go and see a physio and they're going to give you proper rehab to do, an actual structured approach and all the support necessary. Many of you guys are going to go to physio, have a chat, get a sheet of paper, maybe, and that's it. And so often we think, oh, well, I'm not going to get better. I tried physio. And it's like, yeah, you tried something that is rubbish. You have an honest evaluation, Francesca. Do you think the support that you've actually been given, has there been that structure? Go over and have a look at the video on the profile page. If you've got that kind of support from your physio, then maybe, but I doubt it, because more or less everybody we've ever had either come to the clinic as a patient or join the program has already tried numerous things. They've been to physio. 40% plus had done surgery or injections, and they've done everything else before that. So most people have tried all these things beforehand, and you can get better when you start doing the right stuff. Kimberly has been suffering with disc issues for 5 years. I had surgery in 21 and just had more injections and still in pain. It's all about the rehab. We can leverage treatments, we can leverage therapies, we can use, like, we've got the decompression table in the room behind me, we've got the laser over there. These are awesome things. They are really, really awesome. You might leverage an injection, you might leverage a surgery, you might leverage some other treatment, right? You can decide whether you like those or not. I've got opinions on those as they vary, and I've discussed them many times before with you guys. But those are the very top of the pyramid. Those contribute about 10%, maybe less, to your recovery. If you don't have the foundation of education and rehabilitation, they are just going to, you're just going to undermine it, right? You walk out of the surgery and you can't control your lumbar spine. You don't have good technique on movements like squats and hip hinges. You don't have appropriate levels of strength. So why are we going to do it any better this time recovering from the injury post-surgery than we were before we had the surgery? We have the injection. What rationale have we got to explain why we're going to have a better time recovering now than before XYZ treatment, intervention, or procedure, right? We don't take any patients to the clinic here if they're not doing the rehab. And they need to start the rehab before they come in. Because otherwise, you do a great treatment on the decompression table, for example, and then you go and you start bending all over the shop and twisting and you're getting in the car and all that kind of stuff, and you're just undoing any good work that we might have done in the clinic. So there's no point. You have to build that. But when you build that first, then treatments can enhance the process. Then if you're investing money to go and see XYZ therapist, physiotherapist, your osteopath, your chiropractor, or whatever it may be, then they enhance the good work that you're doing, at home with the rehab. But the rehab is the foundation. It really is. And that's been a real paradigm shift for me specifically over the years. It really has. Mary has said, I do walking and pelvic stretching and floating on my back in the pool. That's not rehab. That's just existing. You're not building anything there. And so many will do that kind of stuff. Pelvic stretching, I'm not sure what we're doing specifically. There's a number of different things we could be doing. If they involve rounding the lower back or hugging the knees or pelvic tilting, those would not be helpful. Gentle movements don't change anything. Gentle movements are just that. They're gentle movements. If you have a back injury, you need to rebuild the health of the back. Those things do not do that. Now, that's not to say that walking does not have a role in the recovery process. Walking provides a little bit of movement. Aggravation-free walking being the important and operative categorization, right? Aggravation-free walking allows you to get little bits of movement through here that are not high amplitude, like your knee hugs in your child's pose. And in doing so, we can help manage the excess inflammation a little bit better. It works really nicely combining it with contrast bathing, which is where you're putting ice and heat alternating over this area specifically, not over the leg where the sciatica is, directly over the spine where the source of the problem is. But that's not rehab. And that's another mistake that so many make. Like, what repetition number of the gentle movement is the one that's going to fix the back, right? How do you measure? I did gentle movements 372,421 times, and on the next one, it actually fixed. No, there's no mechanism plausibly where you can explain how that might actually make you better, fundamentally, when we have an injury. Whereas if you go, do you know what, I couldn't do this, and now I can, that's done through rehab. You don't magically be able to do it. I know it's a slight tangent, but it's the same thing, right? You have an injured tissue that has a low capacity for load bearing. Its function is poor. And so you only go about being more effective in the world by improving the functionality of that area. And its main function is to bear load and allow you to move around the real world in bare loading. So I'm not going to be able to go from bench press from 100 kilos to 140 by just doing some small movements and looking at the bar. I have to do it, and I have to do it strategically over a period of time and give my body time to respond to an appropriate stimulus to get change to take place. It's a building process. We'd laugh if the builders came around to do your renovation and they just sat there and we go, we're going to do some small movements for a while. Come back in a week. We'll see if the house is built or if the renovation's done. That's what your body's trying to do. It's trying to repair something. It needs stimulation, especially when there's that building process that needs to take place. What do you think of training while doing recovery? Your rehabilitation is training. The reason we call it rehab is purely for a naming convention, so it's not as intimidating. Rehab is training. Rehab is resistance work. Rehab is strength training. And if you're getting into strength training and you're not doing it in a way that you might do your rehab, you're going to fall foul, unfortunately. Because you have to start out, in order to be effective at strength training, you need to start out focusing on technique. Now, the person that doesn't have an injury that gets into strength training might go through a smoother process learning the technique, but it's the same process. It is strength training. Focusing on technique, then finding the right level that's actually going to challenge you without aggravation and whilst maintaining good technical form on the exercises. The squat being a great example of this. And then over time, you challenge yourself on that exercise. That's what we take members through in the phase 1, 2, 3, 4 process. right? It's a training process. It's just that someone with an injury is probably going to move through that process a little bit more slowly, needs a little bit more guidance than someone without an injury. I would argue the person that doesn't use the guidance, who doesn't have an injury, may well end up with one reasonably soon. So it's something to think about there. Not enough, too many people go in, especially January time of year, right? They go, I'm going to get into working out, and they just go into those boot camp classes, and then by February, you've got a bunch of people joining programs like ours because they've injured themselves, because they haven't gone through it gone about it in an appropriate manner. What other questions have we got here? Jennifer says, I hear conflict information, flexion bad or good, L4-5, herniation and tear. Okay, very good question. Hopefully this helps you guys. The reason you have conflict information about things like flexion when it comes to disc injuries to L5S1 or L4-5 is because different people are operating from different standpoints on what the problem is. So many people are operating on the point that the pain is the problem, the inflammation is the problem, the stenosis is the problem, the muscle spasm is the problem. And so in those sorts of scenarios, the reason you are prescribing flexion and forward bending is because when you bend forwards, you create more space, which alleviates the pain. It feels nice. It stretches something that you are telling people is tight, even though I would argue that that's not a sophisticated enough analysis of what's going on, because muscles can be tight and short, and they can be tight and long. If you hold your arm out like this for ages, okay, my bicep on my arm is fully extended. It is elongated. It's going to start to feel tight and uncomfortable. I can either try and stretch it more, or I can take it off tension. And that's what a lot of people do, or need to do, but they get told instead to stretch it more. So the reason that you are recommended the flexion and the forward bending is because people also say, well, the spine should bend. Yeah, sure, it should, but yours is injured, so don't do that, because you're just gonna put it under more strain. When we talk about spine stability, it's because we're acknowledging there's an injury down here, maybe at L4-5. We cannot control L4-5 as is distinct from L5S1 or L3-4. All we can do is brace the area to protect it, and it needs time to go through a healing and stabilization process, and that's the best we can do to support it. So we leave out flexion. We leave out bending and twisting exercises. We provide stability, because these discs do heal down here. They do heal, but they heal very slowly, and they're under strain every day, another disadvantage. But if we can provide stability and protection, because you didn't injure your back doing something crazy, right? You injured your back leaning for something, grabbing something, putting your socks on in the morning. That was what the flare-ups, where the flare-ups are coming from. Not significant strain. And it's always when you're forward bending, because you're putting the strain on the tissues. Like a scab on my elbow. When I bend, it pulls the scab apart. It feels tense, and then I bend it and it rips, and oh, it might feel better maybe, but there's a sharp pain, and then it starts bleeding all over the place. That is the forward bending. Those tissues on the back are trying to tighten back up again. The average adult spends 9.5 hours a day sitting. When you sit, you are flattening your lumbar spine out. More or less all of you, this is just from experience, and literally thousands of x-rays alongside patients that have lower back and measuring the actual curve of the lower back, you are more likely to have a reduction in the lumbar curve than you are an increase in the lumbar curve. Because, surprise, surprise, you spend all your day sat down with a reduced lumbar curve. You're not, like, that's how most people spend their day. And most people with back pain navigate to rounding over. You are more likely to have a flattened lumbar spine, so you do not need more flexion. Even to the point, and this is really cool when we go through it with members on the live sessions where we share x-rays and we do the analysis, even when some individuals get an extension x-ray, when they are doing an x-ray bending backwards, their spine doesn't actually get to the point where it's in a neutral position. So even when they try and bend backwards, they can't actually get their spine to bend past neutral or even get to neutral. How crazy is that? And then they get told to do more forward bending. They are stuck perpetually with a spine that is bent forwards while they're standing upright. So adding in more flexion makes no sense. But you have to understand, Jennifer specifically, and others that have been told this, most of the people that are recommending you do flexion do not have any significant experience working with imaging with their back pain patients. They might have seen MRIs, which are lying down, don't give you so much useful biomechanical information. But those that do have experience working with the neutral spine or working with patients with back pain and back injuries and spinal imaging, particularly in the load-bearing environment, have this appreciation. I will make no bones about it. It was quite a painful experience to go through as a newly graduated osteopath all those years ago, when you start working with x-rays and you go, wait a second, I was told this, and this makes no sense based on what's actually happening. I was told that a physical exam was actually really, really powerful at understanding the spine, and it sucks. And then when you take a step back and you think about it, it goes, well, of course it does. You don't see anything. You see the very ends of the bone out here. You have no clue what's going on inside. And so that's a very humbling experience to have, but one that's worth having. And that's why you get that difference of opinion. A lot of guys, they just don't have any experience working with this. They don't know what they don't know. So they gravitate to that symptom approach rather than the problem approach. And that's that disparity between the two areas. Samuel said, I hope that's helpful for all of you guys. And any questions, you guys know. It's Q&A. Post them wherever you post. Samuel has said, how many times a week should I hip hinge and step up and squat? And should I do them all on the same day or spread them out? I'm progressing with load and feeling so much better already. Thank you, that's awesome. If you guys want more guidance on this kind of stuff, I would definitely recommend checking out the program. We have just updated a significant amount, well, not significant, the whole thing. Like 250 plus videos, there are workouts there is guidance on just these sorts of things. So check out the link in the profile page. I've posted it in the chat as well on YouTube. Samuel, there's a new video that explains everything as well before you join, so that should be quite interesting for you guys. But fundamentally it changes, right? It changes as you go through the process, to answer the question. When you are starting out learning these exercises, you will do them daily because you need to learn how to do them. And that takes time, and it's not a foregone conclusion that you can do them correctly. And actually, it's more likely that you can't do them correctly because if you could, you probably wouldn't be where you are in the first place, right? You would have recovered quickly, like many people do, by the way. But as you progress on and you start using more load, like Samuel's doing, you're going to find that you can't necessarily be hammering the load every single day, so your training evolves. You might well be doing, and I think generally the squat, what we do in the program is we separate the squat and the hip hinge out into different workouts because those are the primary load-bearing levers that we're using. And so over that course of time, as we're building our load tolerance, we might find that we're only doing a couple. We go from doing daily workouts to actually we're going to do 4 or 5 times a week, and then we might progress down to 2 or 3 times a week, and that's where we start adding in other stuff, right? Maybe we have some deload days. We talk about this in the membership, right? And we spread things out a little bit because as we get further on, the recovery between sessions is the important part. That's what's actually allowing our body. The training is the stimulation to these areas of the body and the muscles, etc. So that then the recovery period between sessions is when we actually get stronger. I literally just did my workout this morning. I did the bench press. And last week I only got 3 and 4 reps. And this week I was getting 4 and 5 reps. Awesome, right? Somehow my body magically got stronger between last Wednesday when I did a workout and today on Monday. That's how it works, right? That's how it works. By the end of the session, you are weaker than when you started. But a couple of days later, like by magic, if you're doing it correctly, you're stronger. Go figure. It's awesome. The body is absolutely awesome. It really, really is, if you're doing things correctly. Too many people, unfortunately, are not. Secret Team said, I have a beautiful day. Thanks so much. 5 a.m. here, time to meditate. Awesome. Hopefully this has given you some good things to meditate on. It's awesome how some of you guys are coming from all over the place. It's cool. Troy has said, is it okay to train the tight muscles affected by sciatica? You're not specifically you are training those because often people with sciatica will have hamstring type symptoms or associated symptoms and tightness. And so yes, you're going to be training those and that's perfectly reasonable. Those muscles are not the problem, they are contributing to the problem, but that's perfectly reasonable. I wouldn't be explicitly training those, like saying I'm going to do some more hamstring work. You do the work that we talk about in the program. If you need more help, I would check that out. Can I do extension exercises in sciatica? We've got a full video. As soon as you are on YouTube, go and check out, type in onto the search page, Cobra, the Cobra exercise. And those of you that are on TikTok, you guys just said it's DM if you're interested in the Cobra specifically. That is a exercise that so many people flock to. It's not doing anything, right? It's not progressive. How many reps of the Cobra do you do to fix your back? 200, 300? How do you evaluate whether you're improving strength and resilience in your back with the Cobra? You don't. The Cobra makes sense maybe, and what I say, the punchline of that particular episode of the podcast is, well, maybe the Cobra makes sense as a test, right? Do 1 rep, maybe 2 or 3 reps every 2 or 3 weeks, just to see, right? Just to see how it feels. But it's just evaluating, it's an evaluation tool, I would say, rather than actual exercise to do. I know many people do it, but yeah. The Paul Sharker said, retrolisthesis on L5S1, very, very common with injuries to that level. How do you repair a herniated disc? I'm depressed without training. Mortgage broker, me, or mortgage broker, Mel. This is awesome. And it's something that a lot of you guys are feeling a bit despondent about your back injuries need to understand. You do not have to do anything to heal your back. Just like you don't do anything to heal that graze on the surface of your knee. Like, your body is trying to heal every single day. What you have to do is get out of the way of the healing process. And so by doing the rehab work, doing education, and doing the relief work that we talk about a lot on the channel here, you are providing the circumstances to get out of the way and help that healing process go. But no one is healing you. You heal you. People can help with work. Your rehab helps that process. By learning the rehabilitation exercises like the squats, the hip hinges, the step-ups, etc., you are learning to create more protection for this area of the lower back so that you stop aggravating it on a daily basis. By getting the education, you are understanding the little things that you're doing every day that are messing up your back, and you stop doing those. So you stop interfering with the healing process. That's the big thing with back pain. We need to educate you so you can get out of the way of the healing process that naturally and should and is trying to take place in every single one of you guys. So important paradigm shift. What other questions have we got here coming in? Guys, those of you on YouTube, we are running at 40 minutes. We've got about 20 minutes left, guys. And remember, if you guys need any more support, there is obviously the YouTube channel. There's the page on TikTok. You guys can check that out. If you guys are finding these helpful as well, these live sessions, do let us know. Do share them. It's appreciated. It really is. And I know many of you guys on TikTok seem to be tagging us in a number of different videos, and that is really appreciated as well. Thank you. Kurla has said, following your rehab video exercises, core 5, do it in the morning and in the evening. Be careful. I would suggest, Kerala, if you need more help, I would suggest looking at the program, link in the profile page, by the way. When we are starting out learning the exercises like the core 5, right, it's necessary to do them multiple times a day because you're not actually doing them in that much of a strenuous manner, but you are practicing, and practice takes time, right? But once you get to a certain level, you need to be doing them hard for you, aggravation-free, of course, within the context of a workout, and you do them once a day. You do relief-based work multiple times a day, but not your strengthening work. Otherwise, you're going to end up overworking it, and that's going to create a problem. As we discussed a moment ago, building your back up after these injuries and helping with the recovery process from these herniated discs is a case of providing the stimulation to the area so that the body can then change between sessions. And if you're working out twice a day, often, and this is something we found a while ago, a good number of years ago, that a lot of members do not support the healing process effectively. Like, some people are trying to lose weight at the same time, so they're in like a 800 calorie deficit on a daily basis, trying to lose weight and then somehow trying to heal at the same time. And I think it's more likely if you're training twice a day, doing training, which is the rehab, twice a day, as opposed to, as is distinct from relief-based work. Relief-based work is not strenuous, right? That's things like the towel decompression, the bed decompression, that's the lower body stretching. That's the stuff we put into the program as the core relief work, right? That's that section of the program. That you can do multiple times a day. But your actual rehab work, which is about building, you generally only do that once a day, and that changes from once a day to maybe once or 4 or 5 times a week to 2 or 3 times a week, and maybe some other workouts interspersed in that. So you have to be mindful of the strategy and how that changes as we go through the recovery process. Yasin has said, to heal an L4-5 disc protrusion, would you recommend flexion or simply hanging? I would not recommend flexion, and I wouldn't recommend simply hanging. Like doing a dead hang on the bar over there, I don't think that's the best option. If we've got these disc herniations, now that's not to say, some of you guys will find that doing what's called a dead hang, so just hanging, it creates that decompression, but there is a large swing. So to help you guys understand it, if you imagine right now when you're standing, you've got a positive pressure of your body weight. Let's just say it's 100, right? Just for numbers, right? You've got positive 100 on the disc. When you then go and hang, you all of a sudden go to negative 50. Why do I say negative 50? Negative 50 implying a stretching pressure because half of your body, your legs, are dangling on the disc. So you've gone from 100 to minus 50, 150 change in arbitrary units. I'm making these numbers up just so you guys can appreciate what I'm saying here. So you've gone from 100 to minus 50. Then in an instant, when you put yourself back down again, you go from minus 50 back up to 100. All of your body weight's back on. When you're doing something like the bed decompression, which is there to create the pumping effect, similar to on the decompression table in the other room, when you're lying down, you're probably at about 0, right? Because you haven't got the load on the lumbar spine. You've got some load of muscle, but let's call it 10, right? You've got 10. And then you pull at maybe 20, right? So you go from 10 to minus 20. or 10 to minus 10, depending on how exactly you want to calculate that, 20, right? It's a much smaller change. There is a phrase which guys don't like, softness beats force. When people go on the table in the other room, like pull stronger, it feels nice. It's not, like from experience, we used to use stronger forces on the decompression table, and all they do is increase the likelihood of post-exercise soreness or post-treatment soreness. This phrase, softness beats force, really makes sense. When you pull too hard, you spend so much time actually trying to hold on so the pull can happen that you don't actually relax into it. And if you relax, you get a better stretch. It gets better stretch through the discs, it's more gentle. And then when we unload the stretch, we go from minus 20 back to 10. It's smaller swings in pressure in the disc. And it seems to, and I'm talking about this in a very non-technical technical way, it seems to result in people getting a better outcome. So if you're struggling with a herniated disc, you might be able to get away with doing the dead hang. And if you do, that's great for you. But it's a lower risk strategy. Also, unless you've got a bar in the house that you can use all the time, you can do it more frequently, doing things like the bed decompression or the towel decompression, which take little pressure, which take smaller amounts of pressure off, create these smaller negative pressures, and it tends to be more effective and less risk, less chance of messing things up. So something worth thinking about. Hopefully that helps. We have a full video on dead hangs, by the way, so you can check that out as well. JP Mobility said, I've got a disc bulge causing sciatica. I need help. JP, mobile valeting. You sent us a DM, I think, the other day. Check out the program. That will help you. Spondylolisthesis and stenosis too. If you've got spondylolisthesis, it's part of the course that you're going to get a stenosis. It's part of the course you're going to have a disc bulge. And a lot of you guys with spondylolisthesis often get really confused because you go and see one therapist and they talk about the spondylolisthesis. Someone else talks about the pars defect. Someone else talks about the herniated disc that you've got, and someone else talks about the facet joint problem. And you think that all four of those different specialists are talking about something different. And then you're like, no one knows what's going on with me. It's like they're all talking about the same thing. You've got a spondylolisthesis at L5S1. You're going to have some degree of stenosis because the two sides, there's a C up here and a C up here, right? When they're like that, they line up. When they're like that, they don't. And so there's stenosis there by virtue of the slit. You're also going to have a disc bulge because the disc bulge can load bear vertically. When it has to load bear like that, you just try and carry a box like that over your head. See how easy it is. It puts way more strain on them. So the discs are vulnerable. The facet joints are obviously going to be affected, and so are the interspinal ligaments. The ligaments all here, because the whole thing's moved into a different position. It's probably done that slowly over a long period of time. But you have to rebuild resilience and not get, unfortunately, confused into thinking that different people are saying you've got a different problem when you have a segmental problem. And really, for most of you guys with back injuries, the spondylolisthesis example is really a very good example for you to understand your back pain, even if you don't have a spondylo. Is that you have a back segment problem, and maybe even by extension, the best level of analysis for you guys as patients is to understand that you have a lumbopelvic problem, because that's the only level that you can interface in. The surgeon needs to know if it's slightly to the left or slightly to the right, because they're going to poke it with something sharp or cut it with something sharp. You guys need to focus at the level that you can interface, which is creating stability between the rib cage and the pelvis. Sorry for those of you on TikTok. The rib cage and the pelvis. That's what you can stabilize. And the integration of that stable structure with movements of in the real world, such as through the squat and the hip hinge, etc. That's the level of analysis that you guys should operate with. And when you do that, it doesn't matter what the diagnosis is, right? You've got spondylolisthesis grade 1 and 2. You've got a herniated disc at L4 and 5, and a herniated disc at L5S1, and a minor disc strain at L4-5. And they can all get better. You've had a spinal implant, you can get better. You've had a surgery at L5S1, a microdiscectomy, and then L4-5 has now all of a sudden got a disc herniation and you need another surgery there, supposedly. You can get better with the same thing. Why? Because if you guys go onto the website and you look at the reviews that we've got on the review section, right? Or you read the comments of people, everybody's got a different nuance to their diagnosis, but they're all doing the same thing and they're getting better. Because that's the level that you guys interface with your rehab. You don't do quirky things. As I've said earlier on the live, those quirky, funny stretches that relieve your sciatica in 3.5 minutes while you're watching TV, those are gimmicks. They are not rehab. They are gimmicks. And so when you focus on stabilizing the spine, that's where you get results. It takes time. It's not overnight, but it does work. Do you have videos on exercises to do for degenerative discs in the cervical spine? Gabriella, we've got the best thing you can do is send us a DM. We're really focused on the lower back. Just because, and I think the neck in many ways is easier in many ways because it doesn't have the same kind of disadvantages that the lower back has. But if you send us a DM, because you're on TikTok, send us a DM and say, hey, Mike, can you send me a whiplash podcast? That'll be a very educational tool for you to help you with regards to the neck. Do severe herniations respond well to IDD and exercises? They respond well to rehab, which is combined with interventions like IDD. Like that's what we do here. Like at the clinic, you've got the IDD table in the back. In the days where I was just doing the TikTok lives, I would take you guys around there, but YouTube would be left on their own for a while, so I won't do that. But yes, they do. If they're done correctly, right? Unfortunately, sometimes when you have spinal decompression work, they say things like, don't do any rehab until we've made some progress on the decompression, which I think is unfortunately a misunderstanding. I would argue you need to do the rehab first and then leverage the decompression, the IDD, to help you make more progress. Like a really nice strategic use that we say to members that are in the vicinity is like, do your rehab work, and as you make progress, when you're thinking about going up, like for example, to a new load on your squat and hip hinge, so that'll be like in phase 3 or phase 4, schedule it so you have a session just after you've done your first test, because you might have overcooked it a little bit or something like that, and then you've got a session to clear things up, right? A little bit of extra care of self beyond what you can do at home on the table, and then you crack on. Something to think about there. Curlo said, so once a day is enough. I'm assuming that's talking about the rehab, and yes, once a day with the rehab work, relief-based work gets done more, and if you need more guidance, check out the profile page, because there's more details, and the program will help you. We've got, with each of the sections of the program, we've got like a strategy section where it tells you how do you approach things in phase 1 and leverage like the core relief work, and then how do you move on to phase 2, and then it's strategy again. How do we go through this step by step over a number of different video segments? And then you've got all the tutorials, and then you've got all the live workouts, and you can follow. It's super laid out for you, so you don't have to worry and keep guessing, right? Focus on getting better, not figuring out how you have to get better, because it's already done for you. What else have we got? When do you recommend going back to the gym for general workouts again? At 20 kilos on RDLs and goblets. Cognation. You could be doing those workouts in the gym. I would be mindful of going back to regular workouts. I don't know what general workouts means specifically, but I'm going to make an assumption that it means doing stuff like bench press and things like that. So let's just suppose that your bench press is like, let's say you can do like 60, 70, 80 kilos, right? So you're using 45 plates. If you've only just started playing around with 20 kilos, you going and picking up a 20 kilo plate to go and load it on the bar and unload it again is going to be an issue. You going and picking up, if you're only doing 20 kilos, 2 15 kilo dumbbells to go and start doing shoulder press, that's now 30 kilos on my spine, right? Thinking about that is going to be an important reflection point, especially if you guys in the gym. I probably suggest you want to make a little bit more progress first, but you can do your workouts in the gym, play around with some cable systems, but that's where the education should come in, right? And that's one of the things we help with our members in the program, you know? It's like, I want to get back into the gym. These are the bits of equipment that I've got in the gym. What do you think is a good idea? I was thinking about doing some cable press, tricep press down. Sure. Some cable tricep press down, that's not going to conceivably be putting a lot of strain on the back. But what you've got to watch out for is when you're going to, like for example, you guys, I'll just turn you guys around so you can see, right? Ooh, you don't want that to fall over. I might have to move you in a second. You got the cable system here. If I'm going to have to take this and just slide it down to the bottom, how am I doing that? That's something to really think about. That catches people out a lot. You know, you're doing your chest press, right? And I finished my set. Boom, stick the pin in. What am I doing to my back? That's where you guys get caught out. So watch out for that. You don't even think it, right? But that's why we think about it for you guys. Troy Ye said, "What's the recommended exercise for tight glutes?" I did some side planks, but if you've got a lower back injury, you said you've got sciatica already here, Troy. Check out the links in the profile page. Like we talk about the core 5 a lot, and there's a 6th one now for the program. Dead bug, marching bridges, squat, hip hinges, step ups, and the single leg hip hinges. That's what we do, because you deal with the problem. Don't get trying to deal with tight glutes or tight this, that, the other. Focus. I mean, if you don't have a back injury, it's going to be different, right? But if you've got a back injury and you've got sciatica, you do the rehab for this. Don't get distracted by the symptoms. Unless, of course, as we mentioned earlier, you have the emergency symptoms, right? If we have the emergency symptoms of cauda equina, we go and get that we go and get that seen to quickly, and then we get back to our rehab. Joe Mama has said, after 2 epidurals for lower back pain, I developed pain in my tailbone. I can't sit for more than half an hour without being miserable. This is the big problem with epidurals, right? or with injections of any sort, I would argue, is that you guys go and have the injection and the explanation of what's happening is not there, right? The injection does not make you better. The injection doesn't fix anything. The epidural does precisely nothing to heal these herniated discs. Nothing, not one thing. What it does do is sometimes it allows you to feel better. You haven't got pain. So now you carry on doing all the stuff that caused the herniated disc in the first place. And getting pain when you're sitting in the tailbone is very, very commonly associated with L5S1. When you sit down, you don't touch the tailbone. You will see that the ischial tuberosities are underneath. The tailbone is here. It is not touching anything when you sit down correctly. So it's not under strain. What is under strain is your L5S1 when you're sitting. 40 to 90% more strain. I'll just remind TikTok that I'm a human. Great. And so what you're doing now is your back's worse because we haven't been given the guidance, right? We may have inadvertently made it worse, I don't know. But the back is worse and it's being aggravated. You need to do the rehab work to build strength back into the lumbar spine. As you do that, as you progress through exercises like those in the program, dead bug, marching bridges, squat, hip hinge, step up, the single leg hip hinge. As you start progressing through those and build resilience back into your back, you'll notice that sitting for half an hour becomes less painful. So you don't get the coccyx pain or the tailbone pain as much. Why? Because the disc at L5S1 has improved its tolerance. You're more able to bear that load. That's how things progress. So that's what we need to work on most urgently. If you need more help with that, check out the link. I've already posted it. I'll post it again into the chat on YouTube. But you can check out the link there. Joe. I've got degeneration of the facet joints. That's very commonly associated with long-standing disc injuries as well. I'm sorry I had to answer the door. Facet joint degeneration, what exercise to do? The ones we've been talking about, Lynn. If you need more help, I would definitely check out the program, but you've got the dead bugs, marching bridges, squats, hip hitches, step-ups. If you have facet joint, or if there is the hypothesis that the facet joints are maybe more related to your current levels, your current pain and sensitivities, I would suggest that when you are doing some of these exercises, you will find that you are more sensitive to errors, which is actually a good thing. And so you'll know you've done it wrong because it will hurt. It shouldn't hurt. So make sure that you are not doing the exercises in a way that's creating aggravation. Remember, all of those exercises should be aggravation-free with correct choreography. Hi, Mike, can I do Oscar? Hey, Oscar. Yes, you can. I would suggest single legs would probably be best, but just be mindful, Oscar, because when you hammer the calves quite nicely, you can get a lot of DOMs, right? I remember doing, it was actually a run a couple of years ago, and I overdid it. It was in the barefoot trainers, right? So kind of like calf raises and epic, like insane DOMs in the calves, to the point where I got to get out of bed and my calves were so tight that I literally fell backwards because they wouldn't dorsiflex, right? So just be mindful that if you do hammer the calves a little bit, the tightness that can develop in those calves afterwards can create a little bit of stiffness in that posterior chain, which could potentially aggravate the lower back. So just make sure you're managing the reasonable post-exercise stiffness, sorry about the helicopter, that might well be associated with training those muscles, because it can catch people out a little bit. Guys, we are running into the last couple of minutes on here, so hopefully this is helpful for you guys. If it is, you can always check out the program for more help and support. We've got Joe has said, copy and paste here, L5S1 fracture, slip disc, trapped nerve, surgery free, mobile, spondylolisthesis and stenosis. After 3 weeks of rehab, standing for long is still a problem. 3 weeks is not a long time. Standing for long is still a problem. I don't know what long is, unfortunately. But whatever long is, as you do the rehab, Jojo, as you do the rehab, as you build tolerance, using those exercises, you will notice that you can stand and do those other things for longer and longer periods of time. But that comes from doing the rehab. Be careful and focused. Oscar said, oh, got a bunch of ones coming in on YouTube. We got Oscar says, also, can I do dumbbell chest press? Yeah, just be mindful, Oscar, of how you get in that position, right? What are the dumbbells compared to the compared to the hip hinge load? So if you're using 215s and you're not using 30 kilos on your hip hinges and squats, be careful. I would suggest, Oscar, that actually doing a barbell bench press is going to be better to be completely honest, rather than dumbbells, because of you just having to get them there. Unless someone else is going to help you out with them, I'd suggest barbell is probably going to be better, or the chest press machine for the time being. Make a bit more progress on the loading on the squats and hip hinges. Lek Z has said, my back hurt when I was lying down or in any other position. It's hard to sleep. I already progressed to 6 kilos. I don't know what my back is starting to hurt, as I mentioned above, because make sure that you're also doing relief-based work. Some of you guys will be pushing the exercises. Maybe you're doing them incorrectly. I don't know. If you're following tutorials, if you're doing them yourself, make sure that you are technically doing the exercises without aggravation. It's perfectly normal for people that have a back injury to find it difficult when they're lying down and difficult to get comfortable. That's a symptom, and that's perfectly reasonable. As painful as it is, I'm sorry, but that's perfectly reasonable. Make sure that you do, like, there are 3 parts to the rehab, right? We've got those 3 kind of pillars, if you will. We've got the relief-based work. I don't talk about that as much because it's not as impactful, but it needs to be done. The rehab work, which is actually doing the exercises, right? On the squats, hip hinges, etc. Aggravation-free with correct choreography, that's what builds you. But also the education. We might well be doing our correct workouts, 25 minutes, whatever it may be. But then if we're undermining that with silly stuff the rest of the day, we're going to struggle to get better. It's really going to struggle. Oh yeah, thanks, Oscar. Yeah, man, we put a lot of effort into that. There's some more stuff coming. This month we've got the additional workouts library. It's going to be released probably the end of September. So keep an eye out for that. I think that'll be really good for someone like yourself, you know, working out in the gym and that kind of stuff. There should be some good stuff in there. What else have we got here? Those are very helpful. Troy said those are very helpful. One more thing. I noticed that lower back pain is peaking after every meal. Yeah, because you sat down. You sat down, leaning over the table, eating. More load on the disc. Think about that 40 to 90% figure. What else have we got? Guys, I'm going to be wrapping this up now because we just passed the hour mark. I'm just having a look through here if there's anything in particular worth picking out that I can do without talking for too long. 3 weeks of rehab, standing for long. Yeah, we've done that one. Spondylolisthesis, stenosis. Office job L45. So sore. When I do more than 1 hour. Yeah, Colette, you got to do the rehab work. Like, if you're going to the office, that's way more strenuous than careful, considered rehab work. A couple more quick ones on here. Yeah, Amy is unfortunately, I've spent so much time on pelvic floor physio for tailbone pain, nothing's worked. It's because you're not rebuilding the actual cause of the pain. Like you've got to rebuild the structures that are at the root cause of the tailbone pain, especially when it's tailbone pain when you're sitting. You're not sitting on the tailbone. You don't sit on the tailbone. The tailbone is just floating in there, right? You're putting more pressure on the disc in the lower back. That's what needs the help. Thank you. Sitting for 15 minutes results in irritation. Yep, because when we sit, we put 40 to 90% more load through the lumbar spine. Good one. Do you recommend any particular exercises for lumbar lordosis and an L5-S1 protrusion? Ignore the lumbar lordosis. It is all human beings should have a lumbar lordosis. The disc protrusion, those are the exercises we talk about. Guys, I'll wrap it up here for today. I will be live again later this week. Hopefully it's going to be helpful for you guys. If you do find it helpful, do let us know. Do consider sharing these with others. And if you need more help, guys, if you are struggling with your back pain and your sciatica and you need more help, just check out the program. Like, the new updated program is awesome. You can check it out in the links. I've posted them in the YouTube video. I've posted them, well, they're on the profile page on TikTok, guys. If you do need more help, check it out. And I'll see you next time. Thanks for joining, guys. And YouTube, thank you. I remember you said I considered the lower squat and hip hinge. Any other exercise? Oscar, just say that again, just before I go, if you can. I know there's a little bit of a delay. I'll keep an eye on the comments, just while this is wrapping up over here. But always, just on that note, always consider as the baseline, whenever we're thinking about adding any other exercise, what is the weight I'm doing on my squat and hip hinge? If I'm doing 60, 70, 80 kilos on my squat and hip hinge, most upper body work, like if we're using dumbbells or anything else like that, we're going to be okay, right? I do think it's very worthwhile, those of you that are recovering from back injuries, when it comes to things like chest press, shoulder press, and other exercises for the upper body, I do think it's really worthwhile doing single arm. I think that can really make a difference. It just lowers the prospective load that's going to be on the lumbar spine. So hopefully that helps. And Oscar, just follow up with this in the group, because I'll be able to help you there. Thanks, guys. Have a good one.